Okay, good day, everyone. You are all welcome to another educative interactive section today. If you were here yesterday when we talked about most common food problems in the elderly, you would attest to the fact that it was really a mind-blowing session yesterday. So today, again, we are here together to, learn again. Our focus on today's session is diabetic foot. When diabetes is mentioned, a good number of us know what we are talking about and what we mean, but diabetic foot sure is a mystery to a good number of us. So today, from Excellent Care First team and other collaborating individuals, we will have a full grasp of what diabetic foot is all about. Would also get to know who is at the risk of having this condition. We also get to know the predisposing factors. We will also equally be made to know every other thing that there is about diabetic foot. How this medical condition can be prevented or managed surely are components of today's discussion. So I would implore you to sit tight, pay close attention, and present us with your questions when the presenter is done with the presentation. As we proceed with the presentation today, you can drop your questions at the comment section there on the platform. You can drop your questions there at the comment section, okay? And as much as we can answer, we will give answers to those questions right here. But if peradventure your question is not answered here, we would love you to also drop your email address also, or send us an email with your question in the email address on the screen right now, so we can mail you answers to those questions. Ladies and gentlemen, I would love to now invite the presenter for today, who is also a podiatrist at Excellent Care First, Esther Echegini. Ma'am, you can take the podium now.
Hello, everyone. You are welcome once again to today's program on diabetes foods complications. So we'll start by explaining briefly what diabetes is. So diabetes is a condition that occurs when there is high or uncontrolled sugar level in the blood. And there are different types of diabetes, but the main two types are type 1 diabetes, which is early onset, and type 2 diabetes. Although previously type 2 diabetes, we expect it to occur when at the age of 40 years, but in this present age, children are developing type 2 diabetes, and the causes are numerous. Mainly, lifestyle is the major cause of type 2 diabetes. And again, the aging population are at most risk of developing type 2 diabetes. And we have a diabetes called gestational diabetes, which is a diabetes that occurs during pregnancy and disappears after giving birth to the baby. This puts the mother and the child at risk of developing type 2 diabetes later in life. And the major causes of food complications is diabetes, uncontrolled diabetes, uncontrolled sugar level in the blood leads to damage to the peripheral nerve and peripheral arteries. That's why you can see many people with diabetes developing foot complications. And that's why it is very important and crucial for us to discuss this today. Although we are relating our discussion on the elderly, but this interactive session is very, very useful for every age, because the earlier you understand that anyone can develop diabetes in life. Initially, most people develop type 2 diabetes because it runs in their family, or type 1 diabetes because it runs in their family. But in this generation, people develop type 2 diabetes even when their parents or their relatives had not had type 2, have not had diabetes in life. So that's why this topic is very important. So for peripheral neuropathy and peripheral arterial disease, because these are the major foot complications resulting from diabetes, whether type 1 or type 2. Peripheral neuropathy can cause loss of sensation in the peripheral aspect of the body. It can happen in the hands, in the leg, even it can damage the eyes as well. And the peripheral arterial disease is the cause of ischemic foot and gangrene. Ischemia is a condition in which there is reduced or restricted blood flow to any part of the body, which can occur in the microvascular system or macrovascular system, while gangrene is dead body tissue due to lack of blood flow or bacterial infection to the parts of the body, as we can see in the picture on the screen. This is gangrene. And the combination of these two diseases can lead to ulceration. And then when ulceration occurs for someone with diabetes or uncontrolled sugar level in the blood, infection can easily occur. And because healing is always delayed in a case like this. And if care is not taken, if not well managed, it can lead to amputation. So let's move into talking a little bit about peripheral neuropathy and peripheral arterial diseases. Peripheral neuropathy is a damage to the peripheral nerve, as I said before. It causes weakness, numbness, and pain, usually in the hands and feet. It can also affect other areas of the body, and it can affect functions of the body, including digestion, urination, and circulation, even vision. Common symptoms include shooting, pain, burning sensation, stabbing sensation, pain, tingling, numbness. There is also a kind of electric shock-like pain someone with peripheral neuropathy can experience. Pins and needles feelings like is also common with people that have diabetes. And peripheral arterial disease is when there is reduced blood flow to the feet, any peripheral aspect of the body. It's not everyone that will experience this, even if they have peripheral arterial disease or even if they have diabetes. But some will experience it, while some will have mild symptoms. Some of the symptoms also include pain in the leg. It could be like a painful cramp in the hip, thigh, or calf muscles. And this pain is also can occur when people are walking, and it stops them from walking. They have to take a little rest in order to allow the oxygen, the blood, to flow well again, and it will allow them to start walking. And this pain also, there is another pain called rest pain. The first one is called intermittent claudication, meaning it can come and go. Why there is another one called rest pain. This only occurs when you are relaxing. Most people experience it when they are sleeping, and due to how painful it is, it stops so many people from sleeping. They have to get up from their bed to walk around in order to get the pain relief. Some will hang their leg over the bed to get it relieved. And numbness and weakness in the leg also can occur. Another sign include nail being brittle or slow in growing. Ulceration, open sores on the feet, legs can also be a sign. And this kind of wounds doesn't heal. Changes in the color on the changes in the skin color on the legs, and then sometimes it can turn to pale or blue or shiny skin are also symptoms of this. And sometimes there is change in temperature, cool or cold. And then whenever you see this, there is a problem that needs attention. You need to contact your GP, your podiatrist, very, very important. And if someone have this problem, that person need a routine appointment to see his or her podiatrist regularly to avoid further complications, especially amputation. And we are aware that many people that have had amputation, research shows that 5% dies within 5 years. So the mortality rate is very, very high. So it's very important to avoid this. So other ways we can manage this kind of food complications resulting from diabetes include the following. Managing symptoms and preventing progression of peripheral diseases include lifestyle changes, which is the primary treatment option. Another one is controlling and preventing these kind of diseases by taking medication. And it's important to check blood cholesterol level, blood pressure, and control blood sugar level. Some of the patients or people with diabetes might need medications to control blood clotting. Another important management and prevention measure is self-care. It is very important to encourage or support loved ones or people in your care to attend their routine podiatry appointments and other medical appointments. quit smoking if they can, because most of the elderly are bedbound, they will not be able to do exercise. So for those who are still active, we encourage them to exercise regularly, no matter the little they can. Some can stay in their bed and do a kind of exercise. We have to keep check on sugar level, as said before. And in some cases, medical procedures like angioplasty or bypass surgery might be needed in managing some of these conditions. So we'll be ending this presentation here in order to allow room for question and answers. This has been considered before, but we just want to summarize it so that people will be able to remember what they've listened to in our previous session and be able to ask their questions if they've not written it down yet. So now it's time for question and answer. So feel free to ask your question. Thank you.
Thank you so much, Ma, for this awesome presentation. Ladies and gentlemen, we can go ahead to drop our questions on the comment box, okay? The chat box there. Let's drop our questions there. Ma, I have a question though. You say that lifestyle is one of the risk factors of type 2 diabetes, and that it's no longer just occur in the elderly, it can occur in younger people too. I want to ask, what type of lifestyle would predispose one to having type 2 diabetes, especially at the younger age?
Hi, good afternoon. Can I take that question?
Yeah.
Hello?
Yes, please. Go ahead.
Hi, my name is Gerald. I'm a podiatrist, and I'm also one of the affiliates with Excellent Care. I do some NHS work and private work as well. So basically, your question is about what predisposes young people to getting type 2 diabetes. Is that right?
That's right, sir.
Yeah, so first of all, I would say younger people are more predisposed to getting what we call autoimmune diabetes, which is most likely related to type 1. But you still see type 2 diabetes in young people, especially those that live sedentary lifestyles, like not exercising enough, certain type of diets, like fast food, and certain research shows that correlates fast food and diabetes. Obesity is also one of the direct link to to type 2 diabetes. But it's an area with ongoing research. Sometimes it could be idiopathic. What that means is that medically you cannot explain why that person has gone on to get type 2 diabetes, but it does happen. But it's also a close link to genetic predisposition. Say if someone has a father or mother that's got type 2 diabetes, they're also likely to get that at some point. I hope that answers your question.
Yeah, pretty much. Thank you so much for that answer.
No worries.
So I bring up the next question. The question is, please, how can someone with diabetes prevent food complications?
Do you want to take that, Esther, or do you want me to take it?
Okay, you can go ahead and answer.
I think with someone who's got type 2 diabetes, preventing complications, the basic is to start from blood sugar control, because no matter what we do, if you don't have optimal blood sugar control, it's going to be a bit counterproductive, if you know what I mean. So we do encourage people to, probably first of all, get diagnosed, okay? And if you know your diagnosis, if it's type 1, you're on insulin, or if you're type 2 and you're on metformin or other medication that can help give you like an optimal, blood sugar regulation. That's the first one. Secondly, lifestyle modification, like putting on footwear all the time, because as we know, people who've got diabetes, they go on to develop peripheral neuropathy, like Esther was saying, which essentially means that you don't have any feelings in your feet. And as you know, it's a weight-bearing area. You can easily bump it somewhere and not even know that you've done that. And because you don't know about it, it means that you're not going to report it. And that goes ahead to get infected. With infection comes sepsis, because if you appreciate the way diabetes changes your body, it means that you will not be able to fight infection as someone that doesn't have diabetes. So that's why we just, optimal sugar control, checking your feet all the time, especially in between your toes as well. Be careful when doing your toenails. It's what we always advise people, because if you can easily nick yourself or cut yourself, and that can go on to, to give you some skin infection, like what they call cellulitis, which is very, very common in people that have got diabetes. Oftentimes you can see people get that and also get sepsis, which is quite fatal. It's not very good. Not very good at all. So I'll say, to summarize, blood sugar control, check your feet, footwear, diet, always attend your podiatry appointment as well, because we will be able to pick up areas that needs, attention and flag that up. And we can also help with, referral to your GP, especially if you've got vascular impairment, which is, one of the main areas, and it affects healing time as well. So it's very, very important. Okay, I hope that answers your question.
All right, thank you so much. Okay, another question here. Does diabetes have a cure, or is it just being managed? And is there correctional treatment for diabetic foot?
You want to answer that? Esther, are you taking that?
Okay, I would like to answer it. Could you please repeat the question again?
You can answer it, and I can chip in.
Okay.
The question says, does diabetes have a cure, or is it just being managed? And is there correctional treatment for diabetic foot?
Okay. We always said when someone have developed diabetes complications, it can only be managed, and the further complications being avoided by good management, which podiatrists play a major role preventing complications that hasn't occurred and managing complications that has already occurred. And again, controlling sugar level in the blood, as we have been saying, is the key. Sometimes some people have ulcer that is not healing, but immediately their sugar was controlled, healing improved. So some people might be lucky and their ulceration healed. So there's healing for people who has developed ulceration, but for people who has developed something called neuropathy, loss of sensation to the feet, it says that it has no reverse when it occurs. Although there is research I read recently that says that there is new technology that could reverse peripheral neuropathy, but we can't make any conclusion on that yet. So Gerard, please, you can.
That's absolutely right. I mean, when you talk about cure, we're not saying if you have diabetes, you cannot live a normal life. As long as you've got optimal blood sugar control. I know people who've got diabetes who've lived with it for 25 years without having any complication at all. So it's doable with the right support, okay? But you also have to be careful because there are so many products out there that have not been, what I say, researched on. There's no evidence behind it. Well, people just put it out there and say, oh, this is an excellent cure for diabetes. So you need to be careful what you take in and do your own research as well. I think I've seen a question from Roy Benson. Right? And it says, I need clarity on this. What are the 3 most common symptoms of undiagnosed diabetes? So yeah, basically, as we know, not everybody just goes to check their blood sugar level. You know, sometimes there are some signs that you can see and say, okay, you know, I need to get it sorted out. So the first most common one that you will see is polyuria. What polyuria means is like excess urination. And the reason why that is happening is because if you appreciate, the kidney has like a filtration purpose. Okay, if the threshold of glucose in the blood is reached, it starts to filter through the glomerulus of the kidney and get into the urine, which is not supposed to happen. In that case, you know, you sort of like start having excess urination because you can't retain a lot of water. And with excess urination comes excessive thirst as well. So the more you're urinating, you know, the more likely you are to get dehydrated. So you see these patients excessively urinating and also wanting to drink more just to compensate for that. And there's a direct link between excessive thirst and polyphagia, which is excessive eating as well. So if you've got someone that is eating excessively urinating, and excessively drinking as well, those could be the 3 main signs. And in that case, it's very important to have your blood sugar checked to know what's happening. I hope that answers your question.
Thank you so much. So the other question here says, are there chances that someone whose diabetes is well controlled can still come down with diabetic foods?
Well, I mean, if it's well controlled, the possibility is quite slim. So when you're talking about diabetic food, you're talking about all the symptoms that comes with it, all the complications, things like neuropathy and vascular impairment. So it's very unlikely, but it's always a possibility. Okay, if you've got optimal sugar control, you rarely get calcification of the arteries, you rarely get damage to the blood vessels because, I mean, you've got, you know, good blood sugar control, just like every other person, okay? But the problem comes when you don't have that optimal sugar control. And that's the reason why, you know, we urge patients to get diagnosed. But one thing that you will also find is that a lot of people get diagnosed late, which means the damage could have already been done, okay? But in that case, it will be an issue, sorry, how would I say, it could be a case of reducing or slowing the progression of this damage, okay? So, I mean, you can have optimal blood sugar control and you will rarely have any damage to your blood vessels, according to certain research that are out there. And I hope that answers your question.
Thank you so much, Gerard. Another question here says, after what duration of being a diabetic can one come down with diabetic food?
Duration. Sorry, can you come again with that?
After what duration of being a diabetic can one come down with diabetic food?
Well, I mean, it's a very valid question, but it's difficult to put a time stamp on it. So it's patient based. Everybody's different. So it depends on how well your blood sugar has been controlled. Certain people who've got diabetes, you know, might have that complication within a couple of months, within a year, within 2 years, you know, because it's not been well controlled. But you get some other persons that get the same diabetes and they've gone on for 5 years, 6 years without any complication, but the chances are still there. But to put a timestamp on it, that's a very difficult one, very difficult.
All right, thank you, Gerard. Another question here, please, can someone be diabetic without knowing?
Yeah, definitely. If you don't check your blood sugar level, you're not gonna know, okay? The symptoms of excessive urination, excessive thirst, excessive eating can also be present in other medical conditions. So we know we've got diabetes mellitus, which is excessive urination of sweet, sugary things. We've got another branch of diabetes, which is called diabetes insipidus. And what that means is it has to do with a more central reason why the diabetes is happening. So people who've got a tumor, like a brain condition that affects a particular area in the brain that produces vasopressin, which helps with urination and regulating the, fluid level and all that. If they get a damage to that part of their brain, they will be urinating excessively as well. Okay, so to distinguish between this, we need to always check to know if the blood sugar is high, because you can have excessive urination without high blood sugar. And of course, you can be diabetic without knowing about it if you don't get it checked. So you see all the signs, it's very important to have it checked, especially if you've got like a family member that's been diagnosed with diabetes. If you think that you're at risk of being diagnosed with diabetes as well, just get it checked to be on the safe side.
All right, thank you so much. Another question here, what conditions could predispose one to wrongly being diagnosed with diabetes?
What condition could predispose you to wrongly being diagnosed? Well, number one will be pregnancy, if I would say, because Esther was saying gestational diabetes. So sometimes you can get gestational diabetes when you're pregnant, okay, and you've got hyperglycemia, which is basically high glucose level. But normally when you deliver the baby, the blood sugar sort of like cascades down and go back to the optimal level, if you see what I mean. And that's the reason why you cannot put that diagnosis set on stone on a pregnant woman. Let the woman give birth first, then you can, do the blood sugar check again. And you cannot diagnose diabetes with just one blood sugar check. It's not done medically. It has to be a series of maybe 1 or 2 fasting blood sugar tests before you can, come up with the diagnosis of diabetes in a combination of the symptoms that the person is having. Apart from gestational diabetes, another condition that can predispose people to diabetes or being wrongly diagnosed with diabetes could be stress. Stress can be as a result of a surgery or an accident. Sometimes when you have a surgery, it's what we call reactive hypoglycemia. So in that case, your blood sugar just kind of like gets high, because of the stress in the operating room. Okay, so if you take a blood sugar sample from that patient at that point, it's going to say it's high, but you cannot put a diagnosis then. Let them come out of surgery, go back to the normal life, do the test again, and then you can confirm your diagnosis. So I'll say those are the 2 sort of like main areas, apart from diabetes insipidus, which I talked about, which is a more central reason, like a more cranial reason why you could have, excess urination. Okay, and I hope that helps.
Thank you. I have a personal question.
Sorry.
I want to know. Okay.
I just wanted to add another point to that last question. Okay. There's another situation where someone can have a reactive hyperglycemia reaction. This could occur in people taking steroid medications. Some people, when they start taking steroid treatments, it will increase the sugar level in their blood. And really, if you check them that time, it will occur that they have diabetes. And in most cases, immediately they stop this medication, their sugar level goes back to normal. Why some people, it will not predispose them to having type 2 diabetes, and they would develop that. So when someone is in such medication or such treatment, it needs to be monitored. Yeah. Thank you.
All right, thank you, ma'am. So this is a personal question. This diagnosis, can it also go wrong when it's done with HbA1c? I don't know.
Well, there's supposed it rarely goes wrong with HbA1c. Because what HbA1c is, it's more or less like, because I need to break it down more on the molecular level first so you can understand it. So you've got your blood, okay, which has hemoglobin. It's a compound of the red blood cell, okay? So if you have your blood sugar that is high, there is a non-enzymatic bonding of the hemoglobin and the glucose in your blood, okay? Now, the lifespan of the red blood cell is roughly around 120 days. 90 to 120 days. So what HbA1c is, it wants to know how long your blood sugar level has been high for. So it gives us roughly an estimate what's been happening with your blood for the past 3 months, which is roughly the lifespan of the red blood cell. So you rarely go wrong with HbA1c, and that's the reason why the NHS is sort of like recommended to do a HbA1c, because you can get a patient coming and we check the blood glucose level right now, and it says, okay, it's, normal, okay? But that patient could have been doing something different 3 months ago, 2 months ago. We want to know, and that's the reason why the HbA1c is a more acceptable test to do, to give us that information about what's been going on in this patient's life 3 months ago. And some of the patients I'm not trying to be harsh on patients or anything, but some of the patients are very smart. So what they do is they go around eating their sweet and, eating different kind of diets, going off track with the plan. And a week or two before coming to clinic to have their blood sugar checked, they go back to dieting because, they want to give the clinician an impression that the blood sugar has been in control. So I would say HbA1c is sort of like the police, of diabetic check. So it tells us what's been happening 3 months ago. Okay, and I hope that helps.
All right, thank you so much. Another question here. Can being a diabetic predispose one to hypertension? Is there any relationship between both?
Do you want to take that, Esther?
I can just say something briefly, and you are the main doctor here. So yes, having hypertension for a longer, uncontrolled hypertension for a longer period of time can increase the risk of someone developing type 2 diabetes. Yeah.
Yeah, so there's a connection, just like Esther said. So having diabetes puts you at risk of getting high blood pressure. I think the main link is as a result of damage to the kidney. So the kidney regulates blood pressure as well, okay? Because it's got, the whole structure that helps in water retention and the rest of them. So when diabetes, is poorly controlled and it starts damaging the kidney function, it affects the way fluid is being regulated in the body. And as a result of that, that predisposes you to having high blood pressure. Secondly, if you start getting calcification in your arteries, it's just like pumping water through a pipe and you start narrowing the pipe a bit. The tension in that pipe goes up, okay, which is essentially that blood pressure thing that we're talking about. So if you start getting calcification in the artery, narrowing of the artery, with obesity as well and fat compressing the artery, your blood pressure sort of like starts going up. So that's sort of like the link between diabetes and high blood pressure.
Okay, thank you so much. Other question here. This phenomenon that leads to diabetic foot, can it occur in any other part of the body?
Sorry, can you rephrase the question?
So this phenomenon that leads to diabetic foot, can it occur in any other part of the body?
Yeah, definitely. So you're talking about the neuropathy and the vascular impairment. Is that what you mean?
Yeah, I think so.
Right. Yeah, it can occur different parts of the body. So I mean, medically we class the complications of diabetes as two large groups. So it could be macroangiopathy, affecting big vessels, like the name macro is, or it could be microangiopathy affecting the smaller blood vessels. So with macroangiopathy, you could see issues with, with the heart function, okay, blood supply to the heart, affecting bigger vessels that are away from the peripheries. And also when you get the neuropathy, okay, and you lose feeling, that's what they call a silent heart attack, which is very common in diabetic patients. So when somebody without diabetes is having a heart attack, classic symptom is that pain in the chest, okay, sweating and, restlessness. Well, a patient that's got diabetes, poorly controlled, with very advanced neuropathy will lose that protective nerve sensation. As a result of that, they're not going to get any pain, okay? Some of this patient can end up dying in their sleep or can just slump and die. They will have a silent heart attack, which is not painful at all because the sensation to that area of the heart is essentially damaged because of the high blood glucose. So I think that's a direct link, talking about outside the foot. Now, outside the foot as well, you can have damage to the kidney, which I already mentioned. But with damage to the kidney, it's just going to affect a lot of things. So there's what we call the renal foot. It's like a kidney foot. So if there's damage to the kidney, it affects the filtration process. In that case, essentially, you get high urea level in your blood because the kidney is not able to filter the urea as it would do in the normally. Okay, so with high urea level, what can happen is that if the patient gets a wound, okay, or an ulcer, it's going to be very difficult to heal, regardless of what part of the body it is. So if you start getting a patient that's got a wound that is not healing, despite throwing everything at it, wound care, debriding, dressing. I mean, you've got some patients like that with chronic wounds that don't heal. Check the kidney function. There's a good chance that it could have chronic kidney disease, which is a direct link to diabetes. I hope that answers your question.
All right, thank you so much. So, ladies and gentlemen, I will be drawing the curtain here. Esther, I don't know if you have any closing remark for us.
Yeah, I just want to thank everyone also for attending today's interactive session. It has been a very good one to be present because it's very, very useful for both practitioners and other individuals. So we hope you really learn one thing or the other new today. And we hope to see you again next week, Tuesday, and next week, Wednesday. And I want to use this opportunity to thank Dr. Gerard, who has so many years experience in diverse medical areas. So it's been a pleasure having you in our midst today. Thank you.
Thank you very much, Esther. Thank you.
You're welcome.
All right, Dr. Gerard, thank you so much for giving us your time today. We do appreciate that. Then this will be where we'll draw the curtain today. And like Esther said, we are meeting again on Tuesday and Wednesday next week for some other interesting topics. So please do well to invite other medical practitioners or patients, the relatives who you think would really benefit from our sessions here. Thank you so much, everyone. we are glad to have you on board today. And I believe that you've learned a lot, because personally, I've picked a lot of points from the discussion today. So this is where we'll end it today. Do have a great day.